I didn't know yet still how bad my situation was until they came back 2 days after and they started querying themselves again. Oh, what's going on? His blood count is still dropping. Wait. His hemoglobin is still dropping. This one and that one. Now the infection is going into his lungs. Okay.
Wow.
This is when it dawned on me, and then they let it slip that I had pneumonia.
Oh.
Quite far gone.
Welcome back to our channel, Sickle Cell Health in Color Pod. I know we've been away for a very long time, and thank you for having patience. We're going to start with something very big. But then before we start, my name is Hannah Eza, and my co-host is
Jaden, Ido, Akinya Sade, live and direct. What's going on, y'all? I've missed you guys. It's been a minute.
Oh God,
I
he's
can't
rapping.
believe it. I'm back. Yeah, I'm back.
He's rapping.
Yes,
We're
I'm
really
rapping.
back.
I'm back.
We're really back. Thank you so much for having patience to wait for us to come back. A lot
Yes.
has really happened.
That's right.
We did not mean to stay this long. We
Not
thought
at
we
all.
would have been here long time ago, but well, some things happened. Life happened.
Yeah.
And we had to take a short break.
That's
Not
right.
a short break, a while
A while
to
break.
come back. A while break to come
A while
back.
break.
Yeah, but we are here. Thank you.
Again, thank you so much for always supporting. Thank you for liking. Thank you for sharing. Thank you for following. Thank you for subscribing. Thank you guys for all you do, because you're the reason why we are here. You're the reason why we're here. And if you're new to this channel, we are, again, as Anna has already said, we are Sickle Cell Warriors Health and Color Pod. We are a podcast to deal with everything sickle cell anemia, sickle cell awareness, and basically health conditions and diseases that affect the BAME community. You can find us on Health in Color Pod on YouTube, and on our Instagram and on our TikTok is SSW Health in Color.
Yeah, thank you so much. So we're going to talk about what people really think about sickle cell. So do you want to start, Jaden?
Yes, we're about to. We've got a few questions here and a few things to go through today. So should we just
Hold on. I know you're not going to like me for what I'm about to do now, but it's a necessary evil. Do you really think you go away and will come back and will start like everything is normal?
I didn't go away.
Okay, my bad. Did you think you spent that long time in hospital and you think everything will just go back? Because there was a time he was in Comunicado. He went in Comunicado. I couldn't get through to him. I got so worried. And you think you just walk back in here and nothing will happen? So today, I made up some things. Actually, I planned to interview him. And he doesn't know about this.
Wow. Yes, I wasn't expecting that. Interview me with what? What might you be saying?
I need to know what happened. What happened to you? How come?
Life happened.
Life happened.
Yeah.
There was a time I couldn't reach you. There was a time you gave us all this care.
I did?
Yes, you did.
Oh, they love me. Yeah, they love me. They really do.
So, in case you're wondering why I'm saying what I'm saying, Jaden was in hospital for a procedure. He went in for a procedure, and he recovered. Well, he was.
Well,
I don't know.
I was supposed to recover somehow. Yeah,
it was a cocktail of sickness that had really happened, and we're going to talk about that because it's still part of sickle cell awareness, and I feel we shouldn't be tiptoeing around what is really happening because these things are real.
Honestly, I didn't know that this was what she wanted to speak about. I'm not really sure if I'm at that place where I want to discuss all of this, but we'll give it a go anyway.
You'll get there.
We'll see.
You'll get to that place. We
We'll
need you
see
to get
what
to
we
that
can.
place.
We'll see what we can do. Okay, let me just
place.
put this down and let's see what questions she has, and let's take it from there.
Let's start with the simplest one. Let's ease you in.
Okay.
How long were you in and out of the hospital?
Wow, I was in and out of the hospital for most of January and February.
But before then, he was in and out of the hospital before then. That was why we couldn't do a lot after our games.
Oh, yes, that's
games.
right. Okay, I see what she means.
Yeah.
Okay. Yes, prior to me actually going in for the procedure, I had an issue where I had problems with my gallbladder. with my well, I had some gallstones apparently, and I had been growing for a few years, and those gallstones were now becoming a nuisance to my sickle cell, and allowing the sickle crisis to come every so often. So as those that might have had this issue in the past may know, the gallbladder, really, a lot of people say that is a organ you don't need very much, but you do. You really do. It's an organ that helps to digest some of the harsh stuff that we put into our body. However, when we pass stuff through our stomach and all the waste and stuff like that, some of it gets lodged into some stuff that the stomach cannot really break down too much, gets lost into our gallbladder. And then when the gallbladder squeezes it, not everything goes out as waste. Some of it remains as like crystals in your gallbladder. And then those crystals eventually, when they are becoming more and more, can then become what you call stones. So when you hear people say they have like gallstones or kidney stones, or those are what they mean basically. So those crystals are now become little flecks that are now grown over time to become stones, and then they become problematic, especially if they're then dislodged. Okay, so that was really
that was the procedure.
The problem.
So
no, that was not the procedure. That was the problem.
That was the problem.
Yes,
but that was taking you in and out of hospital because but then it was triggering crisis.
It was triggering my sickle cell crisis.
Yeah.
So I was having excruciating pains in my abdomen on the lower right side. And so there are some times when, and this really can be caused by things that we eat, oily foods, fatty foods.
We need to bring Shane back again.
Oh my goodness, yes we do.
Bring him back.
I think, in fact, yes, he'll be coming back. Very soon, maybe in the next episode. Actually, in our next episode, we are having Shane Telemac, who can touch a bit more on this. Yes, ultra processed foods that we put in our body that's not good for us, and most of it is sometimes proteins that they're not put together well.
Okay.
They are used, there's a bit too much salt, a bit too much oil, a bit too much fat stuff is left in the protein, and as such it gets into your system and clogs up your system, so your body is not easily able to extract it as waste, and instead remains in your body and then causes too much problems. So you get to my age, in your very good looking, but very looking trim, maybe late 30s,
really
late 30s, maybe early 40s, maybe, I don't know. I forget these days, and they cause problems. Yes, they cause problems, and that was my situation. That was really my situation. So they get flared up because we eat certain things that we're not supposed to eat, and all these fatty foods and things that we're not supposed to eat, or eat too much of, then if it then flares the gallbladder or the gallstone,
which
and
is
then becomes an issue.
Popular problem with
people in our community, the BEM community, as well as people with sickle cell disease as well.
So he went in to have it removed,
and so early January, after waiting for 2 years on the NHS, as a sickle cell patient, you let me wait 2 years for a procedure that caused me so much pain and in and out of hospital. Well, it was not a very great experience, and I went in early January to have my gallbladder taken out, because that was the best cause. That was the best way of moving forward, aside from, because I tried the past few years to regulate manage it, better my eating habits. However, it got to a point where the gallbladder really had to come out because it was causing me too much problem.
It was better
out than in, especially as I have got sickle cell. So it was really triggering my sickle cell crisis. So that was why in the end it was just easier for it to come out.
Sorry about that.
Well, it was meant to be easy.
Sorry about that. And after that, you went in for procedure. And this is the thing. This is the common thing with sickle cell. You go in for one thing, then you end up having issues that triggers crisis as you're treating the. Did you do the keyhole? Or was it okay? Just something that something that is meant to be little procedure. will trigger crisis. And by the
Yeah.
time you know it, as you're recovering from the procedure, you're also treating sickle cell crisis. Then you go back to the procedure, you look for their complications and all of that. And by the time you know it, you're in hospital for weeks.
Crazy. Right?
Wow.
Very crazy. Where people normal will go in for this kind of procedure and they're out the same day.
Yep.
If they're not out the same day, maybe they stay in the next day or they stay for 2 or 3 days and they are back to their normal business. They don't even need to recover very much. Maybe they need to take care of the incision sites. But with sickle cell, it just no. It became something else. And so 2 days of planning became 5 days because I've got young children. Well, not too young, but I've got young children that have to go to school. They need their dad. They have school runs, they have school activities, things like that. And I've got a very busy and a very, a very career-driven wife. A very beautiful wife, by the way. Shout out to my wife. She's a very accomplished career woman, and so she's supposed to be in the office a few days on the week, and as such we had planned me being in hospital in such a way that it wouldn't really affect her, so she was able to take some at least I think 5 days or a week at most of work, and we thought that would be enough, but in the end no,
plans
it wasn't enough.
Changed.
Plans had to be changed quite a few times actually.
That's the thing with sickle cell.
Quite a few times,
and that's what affects people with sickle cell. You can't really plan stuff because the last minute you can cancel, and it's not something to apologize, to be honest.
It's not the nicest feeling.
JD was like, "Oh, my apologies." I'm like, what are you talking about? This is not your making. Don't apologize for being
something
sick.
that was supposed to be 5 days,
but it's not your fault.
7 weeks.
It's not your fault. Stop apologizing for what is not your fault. What is out of your control. That's my take on it, though.
Well, okay. However, imagine being in hospital for that period of time and you're not really doing much, moving around.
Taking a lot of painkillers.
Taking a lot, exactly. Loads of painkillers, loads of morphine, things like that. And your body just becomes very sluggish.
So one of the time I went to see you in the hospital after I got him because he was trying to hide away.
I wasn't really in the best. I didn't want people to see me.
So one of the time I went to see him in the hospital, he had PCA.
Yeah.
And PCA is a kind of IV or IM infusion of how you can give yourself
IV
morphine. IV infusion where you can give yourself as much doses of morphine as you can
on a time basis. So every 10 minutes.
Every 10 minutes. It's a lot.
It's a lot.
It's a lot.
It doesn't mean that you have to use it every 10 minutes for people that know.
If you're in pain,
but if you're in pain, you pretty much have to use it.
And you were on that for weeks and having to go back home. Everything can be normal. You have to first of all recover, wean yourself off. As you're weaning yourself off and you're recovering, and everything is happening at the same time.
The painkillers that you are supposed to be using at home while coming off of what you use in the hospital, then you're still using those things at home, and then as you're weaning off the stuff in the hospital, then they begin to reduce the ones from home in a I don't know. In a gradual way. So you're not really fully off the all your medications. You're still on quite a lot of medication.
So are you on medication now?
Right now, I still am. Yes, I still am on. The prolonged release. They're called the prolonged release medications that help you that you take twice a day, in the morning and the evening. So it just helps to keep your pain at bay, and it gives you a burst of the painkillers through the day. So like on a 12-hourly basis, so it excretes into your body, into your system in a gradual way, instead of like the fast acting one that just hits the pain straight away. Yes.
Bless you. So was this hospital admission different? And if it's different, why is it different?
It was different. It was very different. Because initially,
I'm not talking about the length.
Initially, I went into hospital to have a procedure. Okay. The procedure was supposed to take a few days, like we already said. It didn't. So plans had to change. Okay. That's one thing. And why was it different? I'd been out of hospital admission for near enough 2 years which has been my longest actually, and I'm so happy. I was so happy about that. So this hospital admission wasn't supposed to be long at all, because I thought, I've been, out of hospital for such a long period of time. I wouldn't need to be in for that long for me to be able to just come out quickly. However, when things happened and I couldn't come out quite like I wanted to, and I came out and I had to go back in again, it was kind of really a bit traumatic for me. It affected my family. It affected my kids very well. It affected them in school. It affected, my wife's daily life. She had to manage the kids as well as home, as well as her career, as well as managing me to checking up on me, seeing if I needed anything in hospital. At some point I even told her to stop coming to see me because it just took a lot out of her. She wasn't sleeping very well. My kids weren't sleeping very well. They were always calling, "Daddy, when you're coming home?" So
and that's
it was
what
just a lot. It was just a lot.
Say the carers for people who living with sickle cell, they are the real warriors.
Yes, they are. To be quite fair,
you are dealing with. We talked about this last year. You are dealing with pain. You're dealing with everything that comes, and with everybody
is eyes are on.
Everybody is trying to pick up all the other pieces that you left behind in as much as also trying to care for you.
Yeah, and I gave a big shout out to friends who helped, with like school run and things of that nature, to just help give my wife a bit of the relief. Yeah, that's why sickle cell, it will not be easy. It's never easy, and it's made even worse if you don't have a community around you. You don't have a good support system around you. Trust me, it's not good. And this is why I beg all my young friends, as well as people around my age that are not married. I don't know how they're doing it, because it's a lonely life. It's very lonely. And if you're taking medication and nobody is checking up on you, it's even dangerous too. So, and that's why people like that will end up more in hospital, because they're afraid that if I use this kind of medication by myself and something happens, there's nobody there. So they can't actually deal with it by themselves at home. But I, on the other hand, can deal with a huge amount of it.
Be there for your friends that have sickle cell. Check up on them. Be there for them. Be intentional about their well-being. Not just the fun time.
Please.
Sometimes they might feel like they're being too much. They might not reach out, but you make it as a point of duty to actually reach out, especially if you've not heard from them. And that's the thing. If you've not heard from them, don't think that they're enjoying their life and all of that.
Please, let's say this again. Do check up on people that that have sickle cell on a timely basis. They might not always tell you everything that they're going through, because they are just ashamed of always telling you this all the time, that they're in hospital or they're going through one kind of pain or the other, or this is going on. But you that know them would know that something might not be right. If you kind of just make that conscious effort, even if it's a little text just to check on how they're doing, sometimes it's even more than enough to lift somebody's spirits up, to put a smile on their face, knowing that, because they know that, okay, there's somebody out there, thinking about me, thinking about how I'm doing. So it goes a very long way. It goes a very long way.
But there's a fine line. There's a fine line between trying to be there for someone in pain, in crisis, and there's a fine line between trying to always make them remember that they've got sickle cell. So that's why sometimes people, when they get triggered when you mention sickle cell to someone that they have not told. So they don't know when you are mimicking them, when you're laughing at them, when you're actually being there for being there.
So if your friends snap at you sometimes, it's not because they want to snap at you, it's only because they feel triggered. Maybe they feel triggered, or they just feel like you're being insensitive about what they're going through. Okay,
people always assume that you're now seeking drug when you are in crisis. This crisis, you stayed so long. Was there any point you felt that maybe the nurses didn't believe that you're still in pain, that you're just drug seeking? And was it challenging for you to always say, I need painkiller? How did it feel? Because if I'm a nurse, I'll think the same way, actually.
Honestly, this past episode, it made me realize how bad my situation was. Because whenever I wanted to either reduce my doses or stop or not use as much, the doctors had a field day with that. Like, they were not happy because let me tell you what happened was I had my gallbladder taken out. Before I had my gallbladder taken out, I had 2 consultations about my protocol, how meds are going to be administered if this turns into a crisis and things like that. And so initially my pain control and my procedure was with the surgical team. On the day I had the procedure and I was coming out of anesthesia, that's when the crisis started to hit. So they started doing the right things. They put my PCA on, and then they put me on a subcut painkiller, which is injections, morphine, and even added morphine injections just to get on top of the amount of pain because I'm coming off the anesthetic. Okay. So I was on general anesthetic, so I was put to sleep. So when I was now coming out of general anesthetic, I was in a lot of pain because obviously I had 4 different incision points in my stomach and in my stomach, and so the pain was terrible. Within hours, the pain escalated to something I had never imagined I would get to. It was bad, but they didn't act in time because they thought what they were doing would cover me, but it didn't. And so when my team, this is now the sickle cell hematology team, came to see me the next day, they too thought the surgical team, they have it. They have all the protocols, they have all the things that they need to prescribe. They are not used to prescribing this amount of morphine,
painkillers,
both PCA as well as subcut injections on a very frequent basis, for this kind of procedures because they don't deal with sickle cell pain or sickle cell patients as much as they should. So they thought they'll give me a few injections here and there and I will be fine. However, the pain kept escalating and escalating and escalating to the point that the nurses were running helter-skelter looking for doctors to come and give me more pain relief, more morphine, more things, but it just didn't get there. So they left me over the weekend with the same protocol they had started, not getting on top of the pain. And so the pain got worse and worse and worse to a point that it was triggering and just getting worse and worse. So they left me over the weekend until my team came with the consultant on a Monday morning. When they saw me, then they went to action. Then they did everything they needed to do, prescribed some more other painkillers, other things that they thought would help, started me on other things, But by that time, the crisis had reached a point that no matter what, I had to go through it. Whatever I was using wasn't helping, so I was just using it for the sake of just keeping at bay, not to get worse. So for the next 5 days, it was just bad. Something that was supposed to be not more than maybe 4 or 5 days. And then when I said I wanted to go home, I'd been tired of hospital, tired of food, tired of the food, tired of everything. I wasn't supposed to be in this position. Why am I here? It's just a long time. I've not been in hospital for almost 2 years in the hospital bed. I'm fed up of it. I'm tired of it. I don't like the smell of him. Everything just irritated me. I wanted to get back home to my family. So I think I weaned off myself quite quickly. So just because I wanted to get home. When I got home, I knew there was something wrong. I just didn't know what. I just thought, okay, this was, maybe I'm still recovering. My body will be okay within a few days. No, it continued. The pain continued. Went back into hospital for day treatments for 2 days, the following few days after. I kept telling the doctors, I don't know what it is, but I don't feel right. Every time I walk, I'm out of air. I walk a little bit, I'm in more pain. The whole right side, yes, I had incisions and I know, but my whole right side where I had the surgery up until my chest was just bad. It was just, the pain was terrible. And it wasn't just sickle pain. I knew there was something else, but I couldn't put my finger. And I just kept telling them, "This is not right. Oh, no, it's sickle pain. You know, you just had a procedure, you've had this incisions, all these things." It kept giving me the
They
point.
couldn't see past
Yes.
that incision and crisis.
So everything was conjoined. Just thought, oh, I'm having a hard time dealing with the pain from the incisions. I'm having a hard time recovering, my body recovering, all that. So I couldn't understand that. But I knew every time I went back that this, what were giving me wasn't getting out of the pain. So eventually I spoke to my wife and I said, look, I need to go back into hospital again. I know that you work from home on these days. Maybe you can manage, maybe if I go over the weekend, maybe they give me some more pain relief. I'll be okay. By the time the weekend was over, I was in a even worse state. So I stayed there. And then the team again comes in on a Monday morning. This is after they've already done all my blood tests and done everything. So I could see when they came in that there was something exactly not right, because you could see the expression, you read the expressions on their face. There was like 5 or 6 of them. And they're not normally that many when they come for a ward drive. Maybe there's like 4 of them, you know, there were like 6 or 7 of them. And I was like, what's going on here? And so before I knew it, they said, oh, my HB has gone a lot lower than it's supposed to be. My HB, meaning my hemoglobin level, it's gone low. You know, my white blood count has gone low. This. They need to give me emergency blood transfusions. So they put the lines in. I needed to start on antibiotics because my chest, I was having a bit of chest infection. So I just thought, okay, maybe it's just a normal chest infection. This is because when I was in hospital, I wasn't really, like, where they keep you obviously in a confined ward, and a lot of the patients were like elderly, and so you're not getting much air, clean air into the place and all that kind. And so, in a bid not to be disgusted all the time, you kind of have to breathe in a way that is not as deeply into your system, because you are smelling all sorts of difficult, nasty smells, you know, and stuff like that. So, you know, and also, I don't know how NHS do it. You eat in the same place where you get changed. You eat in the same place where other people are getting changed and they're doing their business. And they expect people not to get infected. Why would people want to go in hospital? This is why a lot of sickle cell patients run away from hospital admission, because we want the comfort of our homes, you know. Anyways, that was happening. So I developed an infection. They started everything, and they told me, oh, they had to put they started me on IV antibiotics, and it was the highest dose for the highest amount of days, which was 5 days. I didn't know yet still how bad my situation was, until they came back 2 days after, and they started querying themselves again. Oh, what's going on? His blood count is still dropping. His hemoglobin is still dropping. This one and that one. Now the infection is going into his lungs. Okay.
Wow.
This is when it dawned on me, and then they let it slip that I had pneumonia, quite far gone. So, what I'm trying to tell Anna is, in all that time that I'm trying to reduce my painkillers, they knew how bad my situation was, but maybe they didn't want me to get like hysterical. They didn't want me to worry too much or anything like that. They won't let me reduce it. And every time I tried to reduce my painkillers, the pain was coming back with full force. So I'd had an underlying.
They knew what was going on, and they know you'd be in so much
and
pain.
they knew that, and also because I don't know how to explain it, but they just knew that, look, if you cut this painkillers right now, it will be worse off for you. So you just have to keep using it until you get to a point where you feel like you can finally reduce it. So I didn't have any issues with
painkillers this time because
around.
You needed it.
Exactly.
And the doctors knew you needed it.
Exactly.
So for people living with sickle cell,
that's right,
we know that gallstone is one of the major health issues or challenges. Challenges. So for education part of it, what would you say the warning signs were?
One of them was, be conscious of what you take into your body. And be cautious of what your body is communicating back to you.
That's why we need to bring Shay back.
Yes, that's why we need to bring Shane back. And it's also one of the reasons why what he told us in the previous episode that we had with him is very important, about ultra processed foods, about foods that are not not consumed, are not
that can break down easily.
no. Foods that are not fueling. Foods that are not cooked. There you go. They're not cooked properly. And they are cooked with excessive amounts of oils, salts, fats, and things like that are not good for any one of us. Don't let anybody tell you that, oh, because you're a black person or you're a brown person, that your forefathers have been eating this meat for all your life and it's good for you. No, it's not. Because eventually it's going to catch up to you. One of the things that, our bodies are not able to break down are these things.
Yeah.
They don't break down these things, and eventually they build up to a point that it then has to get the stomach has to employ the help of your gallbladder to excrete these things, and even your gallbladder cannot excrete them out fully.
The warning sign.
So the warning sign is your body is communicating to you that this food that you're eating is not good for you, or if you're eating them on a continuous basis, it's not good for you. Too oily foods, too spicy foods, too salty foods.
Spicy.
Yeah, too spicy.
Oh, okay.
Yes, because spice was one of the things that was triggering my pain or the gallbladder at the time when I was having the abdominal pains. Yes, spice was one of them. Wow. Too spicy, because as Africans we seem to think that we can handle anything
without spice.
Yeah, we cannot eat anything without spice. Yes, exactly. Which is, if you have a fine balance, is better for you on the long run than too much of something. It's even in the Bible, you know what I mean? Too much of wine, you get drunk, you lose your senses. Too much of a good food eventually catches up to you. Yeah. It is the truth. So that is one of the things. And
I think it's just about balance.
Yeah, it's about balance, exactly. And exercising. Don't let anybody tell you that because you've got sickle cell anemia or you got sickle cell disease, you can't exercise. Everything is within reason and within what is good for your body. Okay?
So those
kind of things, warning signs. And also warning signs are things like if being overweight is a warning sign. If you're not moving around a lot,
those are the causes. Those can cause.
Those can cause.
What I'm asking is the warning sign. Like, how do you know? How do you know when you're having gallstone?
If you know that you're not having, you're not someone that's prone to abdominal pains too much, or you're having abdominal pains too much on the bottom lower side of your abdomen, then there might be something that's triggering it.
Get it checked out.
You need to get it checked out on time. Yes, that's right.
Okay,
that's right.
So I know you, because I know there was a time you changed your diet and you were trying to maintain good diet, but then it was already too late.
It was already
too late. So, but if you started on time,
if I started on time,
if you had started on time,
exactly,
and you would have caught it and done something to help it.
That's right. So more fruits, more veg. That's helpful, and not just the stuff that you see in the shop. You need to get the source. If it's the turmeric, get the proper turmeric. That is grown where it needs to be grown from. You prepare it the right way. Get the organic ones. They'll be prepared the right way. Okay, those kind of things are good for you. If you don't correctly do it, try and add this super ingredients to your diet, whether it's turmeric, spirulina, sea moss, things of that nature.
That's why I need to call Shane. Why?
Yes.
Honestly, because these are the things he was advising us.
These are the things he was advising us, and I'm glad that I actually we had that at the time. But like I said, my issue had already started before we brought Shane on. So even though I started
brought him much more earlier.
If I brought him on much earlier, then maybe it would have made a difference.
That's good.
That's right.
So you just got home, yeah?
Yeah.
What do you need most people around you to do right now for you?
I think just love. Is one thing, being in an environment where you're comfortable. Like I said, one of the things I didn't like is you're in hospital, you're in the same place where other people are passing their waste. Other people, they get too cold, so they don't open the windows. There's no air passing around. You can't really breathe as deeply as you need to. In fact, at that time, just being in my comfortable environment with clean air.
For you, that was just what you needed.
It was what I needed, and being in a confined space for too long, I didn't like that neither. I don't like staying in a hospital bed for too long, and because like I said to you, when I find that when I'm in the hospital, I tend to gain weight. So by the time I come out, it takes me even longer.
Because when I came to visit you in hospital, you ballooned up.
Yes, I'll be bigger. People will think that I'm on a holiday or something. I'm just there eating. But I don't actually eat.
He actually got offended. I said to him, have you been on holiday?
This is why I don't like people seeing me in hospital.
You're on holiday. Why are you looking?
You think that I went away somewhere and I was just eating? No.
You're relaxed. You look relaxed. Too relaxed for my liking, honestly.
I think I'm just, my body type means that I need to be moving around a lot. And I'm very active. I'm a very active person. Once I get going, I get going.
But you've done so well to reduce it, because it was like you shrunk after coming out of the hospital.
So now you believe me, where you thought, you didn't believe me before. Look at this. Oh my God.
Anyways, part of having sickle cell. That's why I wanted us to talk about this, because people don't really understand. We sit here, we do podcasts, we discuss, and I don't want us to tiptoe around the main issue.
Okay. As much as I didn't know that this was happening, I'm just glad that I'm actually glad that, you know,
it worked.
Give a little bit of advice.
It worked. I was a bit skeptical, but at least it worked. So anything you wish people to understand about life after a long hospital stay?
I still need time. If you think I'm going to come out of hospital and then I'm going to be going out with you or my friends and I'm going to be, you need to see me everywhere, it's a lie. If you think that I'm the best, even though I'm out of hospital, that's a lie. I'm still on a long recovery to where I used to be. Maybe even longer because I was in hospital for that long. I need you to just give me a bit more time. I will get back to everybody in a conducive time. And if you call me and I'm not still as, please just give me a bit more time. You understand? That's all I need you to please understand. I'm not ignoring anybody. I'm just not at the right frame of mind. I'm not at the best stage yet to give my time to other people yet. I still need to dedicate that time to recovering fully. You understand? To recovering fully while in the comfort of my own home.
That's to show that your passion is here. Yeah, thank you for doing that.
Yeah, I appreciate that.
People don't understand. You were in hospital for a very long time. You saw a lot, you dealt with a lot, you had a lot of pain that you walked through and you're still walking through. So you need time to, this is the way you heal. But the best thing is to ask people how they heal when they come out of the hospital. Some people will just want to catch up on what they've missed. Catch up on what they think that they missed while in hospital. But for you, honestly, it's just give you time.
Give me time
to come back, because it is traumatic.
I'm also someone that likes to do quite a lot of things, and so sometimes I'm even hard on myself that today I wake up, I'm not feeling the best like I want to feel, and I still want to do certain things, but I need to just be able to
be kind to yourself.
Understanding to myself that look, this was I've been through quite a
so you have
something
to
I didn't
give yourself
expect
grace.
at all.
Give your body grace as well to heal. Yeah, that's good.
That's right.
So final message for our listeners. I still have more questions, but I don't want to go into it. I don't want us to become emotional, so let me leave those emotional parts of it out. So let's talk about your children. Because you've been away, and I know you're very close to your children. I've seen you and I've seen your family, and he's got a very beautiful family, by the way.
Thank you. Appreciate it.
I've seen how close you are to your kids. How did they take this? And that's another thing with parents with sickle cell. It's different when you're single. You can just go stay for 4 months, 5 months, 1 year. It's all right.
I don't think anybody really wants to stay for 4 months.
I'm just saying, but you being a father, even 1 day, 2 days, because I remember last year, you couldn't just be in the hospital because you had parents' evening. You just needed to go there for your son to just see your face. I know how that was really important to you. So going away how did your children take it? What was it like?
I think that was the hardest bit of everything, to quite fair. And it's just so I give you an idea, my son's grades are better this end of term than they were the period I was in hospital.
Oh, that is
That just goes to show
good.
you, yeah, his worst grades are not, it wasn't bad, but his lowest grades were the exams it took in the period that I was in hospital. That just goes to show you, yeah.
It
And it
affected
affects
him
them.
so
And it got to a
much.
point, obviously, as well, with my daughter. Me and my daughter, obviously, very tight, and we're very close and things like
Yeah.
that. She's my little nurse and all that.
And she's very
And
caring, and
yeah,
she's
she's a
very
very caring
thoughtful.
person.
Because
Yes.
anytime we go to see have an event with, and we're seeing the
Yes,
mayor, she
that's
always has
right.
something to give her.
Yeah, she does.
So
Yeah,
that's
she
how I know
does. Yeah,
she's
she
very
does.
thoughtful.
She's a very thoughtful person.
Yeah.
And it got to a point where the person that was helping us with taking her to school, my wife would have to drop her at that place very early in the morning. Not that they are bad people, they are a very nice family. We love them. They are friends, long-time friends and everything like that. But it got to a point where my daughter cried to my wife and was like, Mom, can I not go there anymore? It's getting too much. Yeah, basically, like, she just wanted to be back to her normal routine. You know, like, yeah, she was just fed up of having to be somebody else's, yeah, you know, yeah, somebody else's, you know, like someone else would take them to school or that kind of stuff, you know, and that kind of thing. And I think I've become so used to
doing things
with them, yeah, as well. So that took a lot out of me, and it got to a point where, again, I wasn't happy seeing them in hospital, because we've developed a relationship outside of hospital where they don't have to be seeing me in hospital. When they were young, that's also a thing I struggled with. I didn't like my kids seeing me in hospital because I'm just not able to do what I would like to do with them, and I'm not able to be free with them. I don't like that environment neither, so I don't like them seeing me in that state neither. And it got to a point, yeah, where I just told my wife that, look, here, let them just continue their day to day. You don't need to come and see me in hospital. Just keep, yeah. And it was just difficult. I can't say any less than that. It was just a difficult period because it was really something that was not expected, not planned. And even if we planned for it, I don't think it would have been easy neither.
How can you plan? You can't plan things
Yeah,
like this.
it's I don't know
You can't plan
how
things
else
like
to
this,
say it. How else to say it? Yeah, obviously we're a small, close knit family. So if one person is missing, you feel the effect of that person being missing. So
thank you
it
so
was just
much,
not the
for
best. But
sharing
yeah, we
this,
thank God,
because I know it's a very difficult. I really wanted to do this. This was intentional to catch you out, because if I had planned this, you wouldn't have done
Yeah,
this.
that's why I don't have the vocabulary like I would to describe everything.
Yeah,
But yeah,
catching
it
you
was,
otherwise. Thank you for also
it's all good.
going with the flow.
Yeah.
And another thing is that I know how difficult it was for you to allow me to come and see you in that state, and I say thank you. And next time, don't go incommunicado.
But thank you, yeah. But thank you. I really appreciate your bugging nature. That you come regardless of whether I say don't come. But yeah, I
Because,
appreciate that. Thank
it
you.
really takes a lot for you to allow someone to see you in that state.
That kind of
Thank you so much.
No
And
problem.
thank you for watching today. Stay tuned. Next episode, we're going to come back with Shane. He's going to talk us through on how to manage sickle cell with nutrition and exercise, the diets that will help us reduce the amount of time we're in the hospital. I'm looking forward to this. Get your pen and paper, because I do learn a lot. The last time he came, I kept going back to that video. Even my household, they all went back to that video and we took notes, and it helped us. It really helped a lot of people. So next episode with Shane.
Stay tuned.
Stay tuned. Looking forward to it. Thank you.